My name is Amanda Kamanda. I'm 28 years old and I come from Uganda. I do modeling and I do singing as well. I'm also a performer, some dancing. I do writing. I'm an activist passionate for social change. I also work for charity in helping people from migrant backgrounds and refugees find, a place of a sense of belonging in the UK. One thing about me that no one else would know is I've traveled to over 27 countries across the world. I come from a country where being myself is not something that is accepted because I'm transgender. And my healthcare story comes when I moved to the UK in continuing with my journey, with my transition. Because in Uganda, being transgender is criminalized and we don't even have access to gender affirmation services. And when I moved to the UK, I had a dream of living myself, being free, and having access to the medical treatment that I desired. And when I moved here, the dream was not as rosy as I thought it would be. So, from my background, the UK has always been this country where people can be themselves. And my assumptions were that moving to the UK would be a country where I would have all the support that I needed, because the country being a place that accepts LGBTIQ people. So there was the assumption that the healthcare system would be one of the most supportive systems that help, including trans people, have access to these services. But unfortunately, it also had a few barriers and challenges to get access to those services. Back in 2021, when I moved to the UK, I wanted to continue with my transition. So in Uganda, I was taking my hormones, but because of the system that you come from, most of it is undocumented. You can literally go to a pharmacy as long as you know the medications that you're taking, and you can get it just over the counter, which unfortunately in the UK, you can't just go and get hormone prescriptions by the counter. It has to be prescribed by a medical professional. And when I reached here, I was told that through the NHS, there's a process that has to be followed. You have to get registered by the GP. And when I called the GP to get myself registered and to start my process, the first initial step of booking the consultation, I was never called back by my GP, even when I tried to arrange for an appointment, because I think by the time we're navigating life post-COVID and people are never going directly into the practice. So consultations were by the phone. And at the same time, I was dealing with all this cultural shock in absorbing life, moving in a new country. I mean, look at me coming from a place where I've been criminalized, and now I'm in a place where I can start life afresh, and I'm trying to navigate my life. And at the same time, I moved here doing a master's degree. As I waited, the GP never really got back to me, and I tried to use the school system to tell them that my GP is not getting back to me. And the school tried to reach out to my GP to request for another appointment, but this time it was done in person. And when I reached there to explain, the GP told me that unfortunately for trans people, we don't allow you to have access to these medications because the system says you're supposed to be seen by a gender identity clinic. A gender identity clinic is one of these clinics that are put specifically for trans people, and in the entire UK, there are 8 of them. And the system is designed that for those clinics to give you your first appointment to even start the process, there's a waiting list. And the waiting list for the place that I had to wait was telling me 7 years. That's what the GP told me. To me, it really felt like a punishment because look at me, I've been taking my medications, but I've just moved to a country where I cannot get something over the counter. And I'm now dealing with symptoms of withdrawal because I've been taking my hormones. I'm getting hair loss. I'm getting night sweats. I'm starting to feel really bad dysphoria. I'm starting to get all the symptoms that come with, medications withdrawal. And they're telling me to wait 7 years. The only thing that I thought about that time was making a complaint that, I don't think that these people are addressing my needs. So I filed a complaint because I wanted to see if there was something that could be done for my case. And the GP put it like into consideration, and they referred my case to the hospital, the Royal Bath United Hospital. But referrals to be reviewed and accepted, the waiting time was again 32 weeks. And I'm already going through withdrawal symptoms. I had to find other ways of accessing my medications, and it prompted me to find ways of getting hormones from abroad, the ones that are got from pharmacies abroad. Because sometimes some of them are used by bodybuilders, people who are taking extra testosterone supplements, and some of these pharmacies do ship. The only thing is the way they are brought in the country, they're not labeled as hormones. They put like another label for it, just for it not to be seized by customs. And that was the only way I thought of getting my medications, because I couldn't wait for the 32 weeks. And the danger about self-medicating hormones when you're not really getting the right medical prescription is that sometimes as well, you're not sure of the dosage and how much it's interacting with your body. And I was playing with fire in terms of risking my life, because I started self-medicating with those hormones and dealing with all these, extra things that I didn't know were happening with my body. And as I waited for those 32 weeks, I was going through a lot of, should I say like side effects from the hormones. I would get heart palpitations. Sometimes I would get insomnia. Sometimes I would even get a lot of anxiety because I was not doing it properly in the right dosage. I was not seeing a healthcare professional. But what was I supposed to do in a system whereby I didn't really feel that this was something that was helping to support me as a person? And in those 32 weeks, I finally got a letter inviting me by the endocrinologist to go and look into my case. And the endocrinologist wanted previous, background of my medications. But I'm coming from a country where I've not been. I don't have like background medications. I don't have any documented evidence that states about my medical condition. And I could not tell them about the other things of, self-medicating, because probably I was scared that they would judge me. And in trying to be vulnerable and explaining the situation with them, it felt like it was up to their discretion to decide on whether I could continue getting support even from that hospital. And I feel it was an act of pity, because they looked at me and they were like, you don't have any previous background that documents all this, but I'm still going to prescribe this because from the way I'm looking at you, you really need this. And they did what you call a bridging prescription. And bridging prescriptions are things that happen only at the discretion of that healthcare person, given by the power invested in them. And usually they always need background, previous medical histories and all that. And for my case, maybe it was just one of those acts of luck, I think. The system does not really cater for transgender people in general, because the waiting times are very long. And for people that are struggling with a lot of dysphoria, there's things to do with suicide, there's things to do with depression, there's things to do with self-hatred, and telling someone to wait for a specific time, it feels like a punishment. Even right now as we speak, the waiting lists keep getting longer and longer, and the waiting times, and the clinics are still not changing anything in terms of number, because the whole thing is underfunded. And at the same time, even perceptions between what people perceive the issue to be about, because nobody really understands. And there's a lack of empathy as well in how transgender people are perceived, even in medical practice, even by the community at large. We're judged for everything. During the process, I felt at some point, there was a time I felt suicidal, because the waiting times did have an impact on me. And I remember at that time I was also in an intense, master's degree program, and I had to go to support for like seeking therapy to kind of help me out. But therapy is just one of the things that is supposed to help you out on a psychological level. But then there's the medical part of it, because being transgender is not just about having all this, I don't know, should I say psychological component of supporting you. There needs to be the medical support as well. which I think many people don't understand, because every time they hear a transgender, they're like, yeah, I think it's just a mental health thing. You need to first go sit through a person. They need to first evaluate you mentally and see if it's the right decision or if it's the right thing. And they tell you that maybe wait, or like people really doubt how you're feeling. And as we speak, rates of people, especially the young trans people that are analyzing themselves or doing self-harm, self-mutilation, comes from a result of people not really understanding how they feel when they explain their own condition and things that they go through. The additional support I got was from social groups in terms of, because I was having all these proactive roles as a campaign officer for an LGBT students club. And it was one of the most, one of some of the supporting systems that I had in telling my story, because I also wanted to create this awareness that maybe someone out there could understand what it's like being, trans at the same time you're Black. At the same time, I was also working with other groups in terms of finding ways of volunteering, because I said I'm passionate about helping people from migrant backgrounds. And I had support from migrant groups that were, working with other people that are trying to assimilate and find life in the UK. And together it was kind of helping us to navigate what it's like being queer and maybe African and a migrant as well in this country. Yeah. So trust in healthcare being built comes from allowing diversity and inclusion of people to be part of policy making. Because I feel when decisions are being made at any level, oftentimes people who are having their seat at the table, who are making the decisions, they never have this, factor of putting in diversity. And you've always seen it even in parliament or even in any sort of the big decision-making body. The people that sit there, they're like, who is not having a seat at this table? And when decisions are made, everyone is affected just because some people who are like, I don't know, a majority of a population sit in a place and they're like, we've decided that this is this and this. And specifically for healthcare, I would think that a lot of it has to do with the representation that comes with, policy formulation of having trans people or other marginalized groups be part of this discussion in how they're affected by these policies. The word of encouragement that I would give is perhaps resilience in continuing to be yourself, even from a system that continues to oppress you for being who you are. And at the same time, it's authenticity, because being yourself is one of the most liberating things that you can have. It gives you power, it gives you autonomy, because there's a lot in this world that you have to offer by being authentic, by standing in your truth. And if being transgender makes you unique, it makes you different, then stand in your truth and continue to be who you are. After all, we're all unique in our own ways and we can't be each other. Being authentic, be yourself.